Thank you and good morning. Welcome to the February 13th meeting of the joint CERS-KRS Retiree Health Plan Committee. This time, I'd like to call the meeting to order. Ms. Hale, would you read our opening statement?
Yes, sir. For the record, I want to note that this is the Joint Health Plan Committee meeting of the County Employees Retirement System and the Kentucky Retirement Systems. This meeting is being broadcast via video teleconference pursuant to Kentucky Revised Statute Section 61.826 and may be viewed by the public at the Kentucky Public Pensions Authority offices located at 1260 Louisville Road, Frankfort, Kentucky. It is also being broadcast to the public via Facebook. I ask if you are speaking and not appearing by video, please identify yourself before talking. In the event the video or audio broadcast is interrupted, we will attempt to reestablish a connection. If a connection cannot be reestablished within 30 minutes, the meeting will be adjourned and rescheduled to another date.
Thank you very much. Ms. Rankin, may we have a roll call, please?
Yes, sir. Mr. Powell,
Here.
Mr. Fulkerson,
Here.
Dr. Miller,
Here.
and Mr. Piercy.
Here.
Thank you.
Thank you. All members are present. We do have a quorum. Do we have any public comments this morning?
No, sir, no public comment today.
All right, thank you. Has everybody had a chance to look at the October 21st committee meeting minutes? And if you have, do you have any corrections, deletions, or any modifications? Hearing none, I'll entertain a motion that we accept the committee minutes as written.
So moved. Second.
Have a first and a second. Any discussion? All in favor say aye.
Aye.
Aye. Opposed? Motion carries. Next up is Ms. Garrison from Humana.
Good morning, everyone. We appreciate the opportunity to meet with you all today and provide some information and updates as we have begun 2025. If you want to go to slide 2. So you can see here, we'll spend a few minutes talking about the member satisfaction for 2024. We've got the annual survey results along with 2024 Net Promoter Score results. Then we'll look also at call center statistics for 2024. And then Humana has some updates related to the 2025 implementation and the CMS notice that has recently been released. Along with just wanted to share some information about value-added services. I don't think we've talked much about that. I think we have some interesting additions for 2025, so wanted to bring that to your attention. If we want to move to slide 4. One more, we can go one more. All right, so on this slide, we're going to first talk about the annual member satisfaction survey. So these are the survey results from outbound calls that are made specifically to members by a third party, not Humana, to assess their satisfaction with their experience with Humana. This year, or in all years, the goal is to be 7 or higher on a scale of 1 to 10. So those are the questions that are asked. That's what we're looking for. And for 2024 survey, it was conducted in early December, and they were able to successfully reach about 500 of your retirees, which is pretty standard. We're usually around 450 to 500 to get information about their experience with Humana. So you can see on this slide, more than 9 out of 10 members, 92% were satisfied with how Humana administered their plan in 2024, and about the same at about 91% said that they would recommend Humana to their family and friends. Most members, 86% of the approximately 500 who were surveyed, had utilized their plan. So that is an important part of the questions that we ask. We want to know who's utilized the plan and then also who's called into the call center. So that's all part of the calculation. If we can go to the next slide. You can see here the year-over-year comparison of the overall satisfaction. So for 2024, we have a 92% overall satisfaction rate. Now that is a combination of those who scored us with a 10, a 9, an 8, or a 7. So that comes to 92%, up a little bit over 2023, but you see overall consistency with that number year over year. And then on the likelihood to recommend question, we are at 91% for 2024, also an increase over 2023, and a nice trend upward, I think, on that overall four-year comparison. Next slide. All right, digging down a little bit more into the members' experience with claims management. So are they satisfied with how Humana is managing their claims? Related to how those claims are processed, we did have a 95% rating for 2024, those most in the 10 to 7 range. And then on accuracy, 97%. So good to see that there. And then timeliness, also 94%. That did tick down just slightly, 1% from the prior year. But again, you can see year over year comparisons here are very favorable to their experience with Humana. Next slide. All right, now the next thing I wanted to focus on is related to the customer experience. So these are the folks who have actually contacted our call center and had interaction with our team related to that. So you can see here overall consistent satisfaction with the plan. We were able, about 12% of the folks that we contacted had contacted our call center and had interaction with us. They were satisfied with the overall hold time, with more than 80% of members sharing satisfaction with that. And then members' ability to get their issue resolved also remains relatively high at 79%. And we'll dig into a little bit more of that in the next slide. If you want to go on to the next slide. So disposition of the issue resolution. So this is their overall, how they're feeling about the timing and the resolution of an issue for them. So you can see 66% were able to get their calls resolved within the first call. They didn't need to call back or wait for a return call. And then an additional 13% felt that they had resolved their issue within that time frame. We did have 21% who did not feel that the issue was resolved. I'm looking at satisfaction with the resolution. So we may have resolved the situation, but they weren't necessarily satisfied with the resolution of that. You can see 58% were satisfied, plus the 16% giving us a 74% overall satisfaction. Again, scores continue to be pretty consistent in this area. So overall, we're seeing, good satisfaction, but certainly this is an area that we always strive to try to improve and make sure that when folks call the call center, that they are hanging up feeling like they've been heard and that their issue has been resolved. Next slide, Sherry. All right. The next thing we wanted to talk about is the Net Promoter Score. So we've talked about Net Promoter Score for the last several years with you all. You're probably relatively familiar with that, but it is sort of a unique way to measure satisfaction. So we always like to review that. So the Net Promoter Score is actually a range from negative 100 to positive 100. So a score higher than 0 is typically considered to be good, and scores above 50 are considered to be excellent. So you can see on the chart there at the bottom in gray, we take the Net Promoter Score is the percent of promoters, which is those who say they would likely recommend Humana 9 to 10, minus the detractors, so the 0 to 6, to give us the Net Promoter Score. And this particular Net Promoter Score, Sherry, if you want to go to the next slide, we can look at that one. This is based on, we call this Net Promoter Score T, or transactional. So each time that one of your retirees contacts Humana, we do give them the opportunity to take a survey. And these are the results from that survey. So these are related generally to, would they recommend Humana based on their recent interaction with us? And you can see year over year, we continue to have a really nice trend upward in this area. We've started with the 73 in 2022 and now up to 74.68 in 2024. So we are happy with that, but of course, always something that's on our radar and trying to make sure that we are meeting the requests and the needs of your members.
And just for a little more context there, our overall net promoter score for our entire block of business is right at 71. So, sort of above average, nicely above average for your population.
Any questions about the retiree survey or the net promoter score before we move on to call stats? Okay, we can move on then. Yep. So I apologize for the small nature of this print, but this is how they come out. I tried to make some modifications, but didn't quite work. So had to go with what we've got. But you can see here, this is a year-over-year comparison of the 2024 month-by-month call center statistics, the number of calls that are coming into Humana's call center, specifically from your retirees. So for 2024, that's the green line, and then 2023 is the blue line. You can see for 2023, you may recall we had the Baptist Health issue at the end of in the fall, so that did spike calls, but they did settle down, and we went to a more consistent, more typical call center experience for 2024. If we look at the next slide, this will show the first information here is the total number of calls offered. So in 2024, we had a significant decrease in the number of calls coming into the call center, 71,651 as compared to 83,000 in 2023. But that really was driven primarily by that Baptist Health spike that we saw. So this 71,000 calls coming in is actually even higher than what we saw in 2022. So we did have a few more calls, but generally speaking, I think it's moderated from the prior year. You can then see the number of calls offered versus the number of calls answered. And then the ABA is the call abandoned. So those are people who hung up the phone before Humana was able to answer. Very low there, less than one average. And then the average speed to answer was 13 seconds in 2023, 14 seconds in 2024. And then the average handle time, so that's the amount of time that we spend on a call with someone on average, down slightly again from 2023 to, I think those are minutes or seconds, sorry, 624 seconds. And then the hold time also down slightly to 116. The bottom half of this page does show what's driving calls. So you can see the majority of members, when they call into the call center, they are calling about benefits and claims primarily. We also see a relatively high percentage of folks also calling about communication. So if they receive a letter or a notice from us, an email or any other type of notice to contact us, that would be captured in that number. And then followed by prescriptions, authorizations, provider questions, outbound calls. Those are the calls that Humana makes. Fulfillment, so they may be asking for an ID card related to that, demographic changes, and then anything related to interaction with our online, mobile, or web pages. Questions on that information?
I don't have a question, Tracy, here, but I have a reminder for the board that these stats and surveys are a part of the performance guarantees that Humana does each year for KPPA with the contract. So based on the results, we may or may not get, money returned to us if they don't meet these guarantees. Just a FYI. So these are pretty important and reviewed throughout the year by our staff and by the board. Thank you.
Thanks, Connie. All right, any other questions or comments related to the call center? All right, then we can move on. The next topic that we're going to cover are updates. We'll start first with 2025 implementation. So we did want to share with you, Connie is well aware, you may also be aware that there was an issue at the beginning of the year, well, end of 2024 into the beginning of the year, related to 7,000 KPPA members who were unfortunately moved from one contract to another within Humana's system. And that resulted in letters being generated to members, making them think that they were termed from our system. There was at no point was there disruption in coverage. Members did have active coverage. It was just the movement from contracts. So that was fixed. It was an automated process. Humana has since we worked with KPPA to make sure that our messaging along with KPPA's messaging was aligned. Humana did make outbound calls to as many of those members as we could. I think we actually reached about 1,400 of the 7,000 members overall. And then we did send reinstatement notices. So that was an error on our end. That was an unfortunate situation and caused confusion and concern for your members very unnecessarily. So we apologize for that. Any questions about that? Anything else you wanted to add, Connie, related to that?
No, just that we started partnering, of course, our call center with Humana, and it was on the 30th of December, and we continued that through the holiday into the first week of January. And we were communicating the same message to retirees at that time. And we did have a little influx of increased calls, but remember, there's like, what is it, 55, there's 60,000 covered lives now on Humana total, but maybe 55,000 on the MA plans, which were this group, were in the MA plans.
Right. Yes. Okay. Next slide is also related to implementation.
Which also goes back, when you look at the, I think it's slide 17, where there was an uptick toward
Right.
the end of the year, that's going to be related to this also. I thought I'd bring that clarified for everybody.
Yeah, great observation, Mr. Powell. I would agree that probably did drive that increase then. Okay. You may recall that Humana is now working with an organization, a TPA called Personify Health, related to your medical only and mirror plan members. So we did transition those members over to Personify Health effective 1/1/2025. We have been working with KPPA and Personify Health over the last, probably 6 to 9 months. Working on getting this implementation ready to go. We did experience, Personify Health did experience some delivery delays with the welcome letter and the ID card at the beginning of the year, which I think did result in some confusion, some increased calls with your members. We also did identify some inconsistent communications on Humana's side, in addition to Personify Health. That also, caused some confusion when folks would call Humana. It seemed like maybe they didn't have coverage. So we did rally quickly with the KPPA team and the Personify Health team to consolidate our messaging. We worked with Humana, specifically worked with our call center staff to make sure that they understood the details of this transition and that members absolutely still had coverage. But that, they needed to work with it, would be going through Personify Health going forward. I think, it was a confusing transition for members. And unfortunately, we could have probably had our messaging a little bit more clear out of the gate. We did work to resolve these issues. All ID cards have gone out. There was a welcome letter from Personify Health explaining who they are and that they would be administering benefits on behalf of KPPA and Humana going forward. And we also worked closely with the KPPA team. Anybody that had access to care, we made sure that that was expedited. Going forward, we have set up processes with Personify Health and KPPA so that you all can be assured that you will receive comment resolution for any escalated issues within 24 to 48 hours, just like you have with Humana. And then we are also having ongoing meetings, continuing those meetings with all parties in case anything else arises. So I think we're feeling better about all of that. there continue to be some hiccups, I think more on the operational side, that things that we just need to get squared away. But I think from a member perspective, we've made great progress. One other thing, I know Connie, we've heard, and Connie knows this, we've heard from members, as has the KPPA team, that Personify Health is not necessarily easily recognizable in the provider community. So Personify Health did create a flyer or letter type a letter that can be taken to their doctors that has all of Personify Health's information on it, contact information, how to look up eligibility, similar to what we have on the Humana side for new members as well. So hopefully that will help and give them, it's nice, the members are happy to have something in hand that they can provide to their provider. We want to take them out of that the middleman situation as much as possible.
And we do have that letter. There were about 3,000 to 4,000 retirees enrolled in the medical only plans. That's the board and KPPA self-insured plan that's offered after original Medicare for the medical benefit only. So that letter that we have, we can email it share it with retirees in whatever form they wish, and they can take it to their doctors. And that helps with the recognition. It was Health Comp last year in Kentucky. They changed their name to Personify. So that added that layer of confusion. Health Comp was recognized by providers. And then that name change merger has just changed that recognition a little bit. I feel like this flyer and other attempts, Humana and Personify have been calling providers and as well as retirees and assisting them with this issue. Thank you. If you have any questions, please let me know.
All right. Any other questions or comments on the transition? Okay, we can go to the next slide. So annual enrollment, just wanted to share kind of what the experience was for the annual enrollment events for 2020. I never know whether to say 2024. They were held in 2024 for the year 2025. So we did host in-person events. We were in Lexington, Louisville, Frankfurt, and Erlanger. We hosted one virtual event. Pretty typical attendance. We had more attendance last year. I do think that was driven by the Baptist Health situation. What I find most interesting on this page, though, is the online recorded presentation and the number of people who are taking advantage of that. So for the last several years, Humana has created an annual enrollment recorded message, and it's the same material that we go through at the in-person meeting. It has a voiceover that explains all the benefits. And so this year we're up to 593 views as of a few weeks ago. But that does stay out on KPPA's website. So folks and Humana's website, so people can view that when they need it. And I think that's very beneficial. They can look when they are most interested and have the most questions. So I'm happy to see that. I think last year's numbers at this time were probably around 400. So we're seeing a nice increase year over year on that. And then go ahead.
Sorry, I was just going to state that it stays on the website for the new retirees to access. So we refer them there. They can get a view of kind of what their benefits are, and then they can contact Humana, before they enroll if we need to. Humana will talk to them if they're not an enrollee and explain things based on their individual level. So I feel like this is a really good outreach. It's web-based and they're taking more advantage of it each year, the retirees. And we do the same for the non-Medicare plan. We have a webinar that's recorded and out there for new retirees as well for the plan year 2025.
All right. And then lastly on this slide, you can see Humana continues to support the KPR meetings. We attend those when requested. This year we did attend 5 locations and we had about 78 participants combined. So we're always happy to attend those meetings. I know I've partnered with Mr. Totten on several meetings in Lexington, and we've been in Louisville, and then also I think down in Bardstown, along with a few other locations. So always happy to be there and to get to meet with your retirees in those settings.
And Tracy, I just want to say how much that is how important that is for those retirees being involved with the KPR. I know that that's always one of the larger attended, and for the most part, and that they some of them look forward to that every year just to be able to have that question and answer and explanation. So we appreciate your and Humana's efforts in doing that for us. Thank you.
Absolutely. Happy to do it. All right. So the next slide, I'm going to take a breather and let Larry speak to this slide related to the CMS notices.
Thanks, Tracy. Good morning, everyone. Yeah, so wanted to just give you a quick update on the recently released CMS advance notice. As you may know, the funding for these plans is largely provided by the federal government through CMS. They reveal their subsequent year changes to their rates via the advance notice, which came out a little earlier than normal this year. It was released on January 10th. There's a public comment period, industry comment that's allowed for. They then finalize their 2026 rates via the final rate notice. That will occur no later than April 7th. So what we saw in the advance notice was an increase of about 2.25% compared to 2025. So that is higher than the change from the prior couple of years. I will note that there are still significant industry headwinds that we are seeing that will affect rate renewals for 2026. Those include continued higher trends for medical and pharmacy utilization. That's driven by just overall utilization changes, as well as the continuation of biosimilar and other brand medications that are coming to market. There's also some uncertainty tied to Part D funding due to the IRA changes, the biggest of which went into effect in 2025, but they flow into future years as well. And so that will impact the Part D benchmarks, which is the funding baseline that we get from CMS. There's also the 2026 negotiated drug pricing. And so those impacts sort of are yet to be determined. So good news in the form of higher expected CMS revenue for next year compared to this year, but the industry is still pressured through the things that I mentioned. So we'll know more definitively about the final rates when we get the final rate notice in early April. We owe the renewal to KPPA no later than July 1st. And so we'll have plenty of time to absorb that rate notice and factor that into the 2026 rates. As you may recall, this is coming up on our 4th year of the current contract. So there was agreed upon rates. There was a sort of a rate schedule for the first 3 years. And so the 2026 rate will sort of be the first one that's sort of a traditional renewal, so to speak. So any questions about that? This is, a big deal industry wide, and it'll be finalized as we get into April.
I have a quick question. Go ahead,
Go ahead.
Connie.
All I was
No.
gonna speculate, and I know it's hard to speculate, but changes based on new administration. I guess it's really hard to ask that question right now, whether that will impact any of the notice going forward. And do you think that you'll have a snapshot of the renewal in our May Retiree Health Plan Committee or Joint Committee meeting that's scheduled for May, possibly?
I'm not sure about the renewal itself, Connie. I mean, we'll certainly
Okay.
have the final rate notice at that point, and we'll be happy to talk about what that says, what it means for us. Would be happy to arrange a phone call with our legislative affairs team if that would be of value to you and your staff and the board. We have folks on the ground in Washington who
Okay.
are our liaisons to CMS. What impact we are expecting via the new administration, I think that will start to become more evident as we see the final rate notice. Again, the 2.25% for 2026 is better than 2025. 2025 was flat to slightly negative, but so that's good.
Yes.
How everything else plays out from the standpoint of the new administration and things that we're already seeing via executive order and other things. I mean, I think that's a fair, open question. We don't know.
Yes,
But
sir.
we will know more as we get closer to April.
I appreciate the offer for your teams to update the board. And if possible, maybe the board would consider that for the May meeting. That's just a thought that the board can explore, the committee. And I appreciate that. Thank you, Mr.
Yeah,
Lowe.
we'll put that we'll pencil that in for a legislative affairs update for the May meeting.
Thank you.
And Connie, you did a great job of making that they worded that just the way you did. I was going to be same question, but probably not as well phrased as you did, because I was going to ask about the executive order of doing away with removing the cap.
And I'm
So-
sorry for jumping in too early, Mr. Powell. I
Oh,
think we had
no.
the same instinct there, sir, which is a good
Yeah.
teamwork. I appreciate that. Thanks.
From a benefit standpoint, I should have pointed this out. The advance notice didn't really provide any material or fundamental changes, or at least, again, it's the advance notice. It's not the final notice, but it didn't reveal any changes to the structure or the methodology, so to speak, for group MA plans, like what we administer for KPPA. The $2,000 maximum out of pocket that went into effect in January through the IRA, that is indexed every year, and so they did reveal at that point that it will rise to $2,100 for 2026. If there's any other changes to those types of things, we'll know that through the final rate notice in April.
Thank you, because I know I got a couple of questions about that when that order came out, and people was wondering if it was going to be effective for this plan year and all that. So I appreciate the clarification, Larry. Thank you.
You're welcome.
All right. Thanks, Larry. We can go to the value added services. I'm not sure that this is something that we've talked about with this group in the past. So I just wanted to bring it to your attention. Every year in January, February timeline, Humana sends to your retirees information about value added services. So these are services that are available to them simply by being members of a Humana Medicare Advantage plan. And they are discounts. They are various different services that they can take advantage of. You can see here, these are a few of the main examples, or the main ones that we hear people use the most. The Humana Dental. So if you over and above the KPPA dental benefit, there is an opportunity for a 25% discount for some services with Humana dental providers. There's an iMed discount, so discount on eyeglasses and eye exams. Then there's also True Hearing, which offers a 60% discount to Humana Medicare Advantage members if they use their network. We also have a Lifeline Alert savings program, so a discount on those alert systems if they are needed. Mom's meals. So we've talked about mom's meals probably in the past. Those, when members are inpatient in the hospital, they're entitled to mom's meals to be delivered free of charge to them. But they also have an option through the value added services if they would like to continue to receive mom's meals, or maybe they've never been inpatient and they just like to try them. So it's an in-home delivery service of balanced, nutritious meals that are delivered frozen to the members' homes. And there are savings available to them as Humana members. And then we also offer a drug discount program on various different over-the-counter medications, that kind of thing, that folks can take advantage of. Every year we evaluate the services that are offered as value-added services. And this year we've added 2 new programs. If we can go to the next slide. The first one is a travel discount program. So we often get asked at our meetings about, well, is this coverage sufficient if I'm traveling out of the country? And of course, generally speaking, we would say no, that, it covers emergencies, but it's not going to give them transport or anything. So now one of the value added services benefits is an opportunity for a 5% discount through IMG Travel Medical Evacuation Program. So members are receiving information about this. And then the last one that's been added for 2025 is the Petsy Pet Telehealth Discount. So for $1 a month, folks can sign up to receive telehealth services for their pet. So that's an unlimited number of visits. They are available via internet, web-based visits, 24 hours a day, 7 days a week. Their typical consultation price is $20. So if they join the program for $1 a month, that's, could be a big savings should they find that necessary. So that was really a conclusion. Those are the main changes to that program for 2025. I'm happy to take any questions related to these topics or anything else that we've discussed or anything we haven't discussed with you all today.
This is actually for Connie. I think it would be a valuable aid for our members if we could put like a link on our retiree health to those services, such as the travel insurance and the pet insurance, that make it easier for our members to access those and not have to go searching for it.
Certainly, we can work with Humana to do that. Our communications team we do things like that. We do link some things like the books and literature like that, how to find the physician and the formulary, so we can put it in that place. And then we could also do some Facebook or social media posting saying, hey, you have a new benefit for, and then we define which group of retirees. And yeah. Perfect, Mr. Powell. Good suggestion. I appreciate that.
Yeah,
Thank
we
you.
can look at that. Just FYI, CMS is cautious about these value-added services and how we promote them, because they can't be considered enticements to choose our plan. So we are limited on how and where we can share this information, but we will definitely look into how we can make it more readily available. Just so you know, it did go to all of your members in the mail in the last several weeks. So they should have that detail, and it is available via the Humana webpage as well. But Connie, we can talk and work with our folks to see how we can make this more easily available. Yep.
Yeah.
That will be good. We have taken these books once before and handed them out in retiree meetings. We could do it as KPPA, but they can't really do it in their webinars or their
Right.
outreach. But if we take it to a KPR, or I just show it to them and say, you got this in the mail, and then at times if Humana shares it, then I'm able to, share it individually with retirees, and we've done those different steps. Or just if a retiree calls about it, we kind of put them in touch with Humana and get it mailed again to them. So yeah, we just wish CMS would relax that a little, but they have their reasons for that marketing approach. So we'll just try to figure out how we can work within those boundaries.
Yeah, it just it can't be promoted to prospective members. It can only be, we can talk about it all we want with existing members, but not with prospective members.
Yeah.
So,
Yeah, I think it would be important that, because you send it in the mail and they get, I remember something about that. And I
Right.
thought maybe if we had a little blurb on our informational page for retiree health, that would say, give them a night where they can go to get more information,
Right.
kind of thing.
Completely agree.
Also, since you were talking about service, I encountered something here at the end of last year. I didn't know Humana did. I went got a new doctor, and the doctor only takes Humana Medicare Advantage because Humana helped them start their office, and I think that is a great plan to allow more doctors to be in a community that cannot maybe not necessarily afford to set up their own office on their own to start out with. So I think that's a great way to get better health care out to the public better. So I just wanted to let you all know that I encountered that and I thought that was a great business opportunity.
That's great. I'm glad that worked out.
All right. Anything else you wish to add, Ms. Garrison and Mr. Lowe?
That's all I have.
All right, thank you. Next up would be the 2025 open enrollment statistics. We're talking about plan years. Ms. Sutherland.
The next few slides are the final statistics. Can you hear me?
Yeah, we'll get a little feedback from something.
These slides are about the final statistics for the 2025 open enrollment period. The first few charts show a comparison between 2025 and 2024. The first ones here shows the number of enrollments completed online and processed by RHC counselors. The online enrollments were similar for both years, and there was a slight increase in enrollments processed by RHC counselors for 2025. If you go to the next slide. The Form 6256 is an annual requirement for hazardous duty retirees to verify their health insurance dependents are eligible to receive their contributions. There was a small increase in the number of forms completed online, and in turn, there was a small decrease in the number of forms processed by RHC counselors. There was a decrease in phone calls for plan year 2025. The number of email communications are comparable for both years, and there was a slight increase in the office visitors. Go to the next slide. Thank you. Every year, KHP open enrollment email notification is sent at the beginning of the open enrollment period. There was an increase in members who opened and viewed the content of the email this year, but there was a decrease in the number of members who utilized the links that were enclosed. And
Abby, do you want to mention what links were enclosed? And it was maybe the same information for the previous years. I just thought they might find that interesting. It was things
since
like.
there wasn't any. Go ahead.
No, that's all I had. Just.
Okay. Yeah, enclosed in the emails every year is the links to the benefit information, what they'll receive in the mail, along with premium contributions, a link to the to do the online enrollment, and the online forms. So without there being really any plan changes, they just didn't utilize the links because we let them know that there wasn't any cost changes or benefit changes for 2025.
Thank you.
Any other questions? Okay. For our outreach, we attended 3 of the KHP benefit fairs. The largest attendance was in Frankfurt. A recording of the KHP webinar that we did was placed on the KPA website, and so far we've had 792 views, and this it continues to increase every year. The numbers go up significantly over the previous year. We also attend the various KPR meetings. The largest attendance, again, is in Frankfurt. That tends to be our largest audience. So, is there any questions or anything that we didn't cover that you'd like to see?
I have a quick question here, if I may.
Yes.
Do we receive any type of statistics from the personnel cabinet as far as what percentage of our non-Medicare eligible folks do the Living Well promise?
We receive a list every year of those who did not complete it, but we don't have the percentages on that. It
Okay.
does tend to go down each year,
Okay.
especially as they get used to knowing that is part of the benefit. The numbers do go down each year.
Okay, so if we know the number who didn't, and then surely we know the number that are non-Medicare population members, correct?
We can take an educated guess because
Okay.
in those numbers include members who transition to the Medicare plan. So
Okay.
they are not actually required to, and new retirees are not required to if they come in later into the plan year.
Sure. Okay. Well, I just think we have probably not an insignificant number of people that are basically lighting $500 a year on fire, or almost.
Yes.
So I would be curious what those numbers look like. And I know they have 6 months to get it done, and it's on them, and I'm not saying they don't, but I mean, I know that every year I get contacted by a few people who think they did it the year before, and there's such a wide range of time. You think you did it and you didn't. You're thinking about the year before. So I would just be curious how many of our members actually don't do it. I'd suspect it's probably the same or substantially the same over and over again that don't do it.
Mr. Piercy, I did have some conversations and suggestions with retirees this year, as
Okay.
you've received it. And so I think we should commit to another email blast. I wanted to send one out in March, and then again, we send one out like very last of June saying, hey, you've got till July 1st to do this. And we're keeping it on the cover of the yearly open enrollment books. The problem is some of the retirees, like you said, they think they did it, but it was the year before. And then let's say a retiree turns Medicare eligible and leaves his spouse and children. Well, the new plan holder may not know they need to do that. So there's some confusion there. But if we're sending these email blasts specifically to the people who did not complete the promise, because we have a report from DEI, the personnel cabinet, their vendor, who gives us that information. And there is one appeal process they can do. If they can find proof that the retirees, they did do it or communicate it with that vendor, they will overturn that at DEI. So we've helped some retirees in that aspect.
Okay.
So it's a problem when it's mainly the city and counties that come in and don't have the KEEP insurance before they retire. And so they don't know there's such a thing. And of course, it's on the new retiree book. It's in the hand. It's so much when they retire, I think that slips their mind that, hey, you have this. And then we repeat it every year during open enrollment and send out the email blast then to the people on the KEEP plan. But they still I find that group may be the ones. And so, we look at these every year to find different ways to attract their attention. And I welcome any suggestions. As you have stated, the percentage would be good, and those type of things. Yeah, it is a quandary we continue to evaluate yearly, sir. And I appreciate any feedback I get.
Yeah.
And even if it's just a raw number, I'd just be curious how
Yes.
many folks didn't do it.
Yeah, we track, there's a few thousand every year. We say a few thousand, but it could be 2,000 to 3,000, sometimes 4. It just fluctuates with those numbers because we have new retirees every month, and then we have people aging into Medicare every month and things like that. So because our Medicare people are still saying, they contact us and say, well, do I still have to do that thing? And we're like, no, you're not on that plan any longer. You're not required. So
Yeah.
it is a challenge.
But if 2,000 don't do it, that's almost $1 million out of retirees' pockets right there.
I agree. Yes,
Yeah.
sir.
Yeah.
Yes, sir.
And Keith, they do present that at the KEHP Group Health Insurance Board meeting, but it covers the whole plan, just
Right.
not the retiree.
Yeah, including active employees. Yeah.
Correct. So, but it's also discussed at that also. And to kind of understand what the retirees too, when you retire, you're just overwhelmed with so much information when you're changing from your insurance, from going from the KEHP plan to the Medicare, and there's a lot goes on. So it's understandable. There's also some confusion. But great questions, Keith. Have anything else you wish to add, sir?
Nope,
All
that's
right.
it. Thank you.
Thank you, sir. Anybody else have anything they wish to add? All right, thank you. I just wanted to say this is my last board meeting for the joint retiree health plan. I want to thank everyone for their support, understanding, and guiding me along my last 8 years that I've been involved with this. So thank you. It's been a great pleasure getting to know everybody from Humana and understand how it works, and working with all these board members and the staff at KPPA. I just want to say thank you so much.
Well, Mr. Powell, I want to thank you for your service in helping us with this committee as the other board members will probably testify to. You've jumped in with the non-Medicare plan and took over learning that and supporting the retirees and you know, the questions to them and asking about the benefit and understanding it as well as the Medicare. So I really, really appreciate your teamwork. You have always worked with us and we've coordinated and I think we've accomplished quite a bit with that process. Thank you, sir.
Thank you, Jerry. I
Thank
really
you.
appreciate it.
Yes, I
Thank
just
you,
echo
Tony.
everything Connie said. Thank you, Mr. Powell, for your service.
Thank you very much.
Thank you. Thank you. All right. That being said, there's no other business, and I'll declare that this joint health plan committee is adjourned. Thank you all.
Yeah.